Okay, so we are recording this episode for Breast Cancer Awareness Month with Dr. Toni Zhong, who is not only a friend, but has an amazing title, Belinda Stronach Chair of Breast Reconstruction, UHN, Toronto.
Wow.
It's a mouthful.
That is a mouthful, but sounds very important, which it is.
It is.
Yeah.
Well, we just recorded the podcast and we know
just
she's
found out what that title means.
Yeah.
And she is just an incredible woman, professional, advocate to have and to listen to. She is incredible. I've heard her speak so many times publicly as she's a friend, but you know, the takeaways that I got from this podcast were so important, and I think will resonate with everyone, no matter what your situation is. So
Yeah,
it's
if
worth a
you're-
listen. It's really, you know, look her up. She's a gem, and Toronto's lucky to have her. And so are you for listening to this. So
Yeah, I would say if you are a woman, regardless of your history of breast cancer, regardless of your age, listen to this episode. And I hope you guys find it as informative as we did. All right. Welcome, Toni Zhong, Dr. Toni Zhong, to the podcast.
hello, Toni.
Thank you, ladies, for having me.
We're so excited to have you here. For those who don't know you, you are the Belinda Stronach head of breast cancer reconstruction at University Health Network.
That was all without looking at a note, everybody.
Totally.
Was
that
that
was
good?
that was very
That was-
impressive.
I was
The
like, that
Belinda
copy.
Stronach chair in
Chair.
breast cancer reconstruction.
Okay.
But other than the
Almost.
chair,
I was just looking deep
chair
into your
versus head.
eyes as I was saying that.
I
It
was
was perfect.
watching, like
Yeah.
I literally think I saw your brain move. When
The mice were moving. I was really, I didn't want to
you
screw
got
that
it. You essentially got it.
up. So you, maybe I'll explain our connection first and then we can just kind of dive into it. I
and
think
also what that fancy title means.
what the fancy
Right.
title.
True.
Yeah.
True. That's
Well,
yes,
do you
it may
want to explain what the fancy title means before we get into it?
Sure. It just means that I am the chair, but I also am the director of breast cancer reconstruction. So I oversee research, I oversee the patients. I work with 3 other partners too. But about 5 years ago, Belinda Stronach was very generous and endowed funds to go and fund this position so that it would be a very recognizable position and help bring awareness and advocacy and just to really support the extra work that the chair would do to help patients who suffer from breast cancer. And also just to make breast reconstruction more of a priority in our hospital.
That's amazing.
That is amazing.
I actually didn't know that. I didn't know that. That's why.
Did not know that.
That is why you have that fancy title.
Yeah.
Okay, exactly. So
Yeah,
that
okay.
is the origin of it.
Yes, Belinda.
And you know what? One of the things that I've come to learn in my practice is that our healthcare system is good, but it really only covers some very essential services and surgeries. But if you're really wanting to do cutting edge research or other, just beyond the essential services, you really need extra funding. So people who are so generous as to donate funds or start funds like this really goes a long way to helping, the women that are suffering from this disease.
Well,
So it's
and you
really
helped
important.
so many women. Like it honestly is crazy to me. I mean, I'm sure so many of our listeners right now know who you are, have a connection to you in some way, whether it's personally or a friend, sister.
Well, that's how you guys connected, right?
That's how we connected. I was diagnosed with the BRCA gene when I was 25. So that's a gene that just puts me at a much greater risk of getting breast and ovarian cancer, like 80% higher compared to the rest of the population. And we also became friendly through our children, who are at the same school together. And I had never made a decision about, doing anything about it necessarily, but staying informed and staying on top of it and just knowing what my options were. And after I was done having kids, Benji had said, you know what? Toni, you should talk to her, have a coffee with her and just see what those options are if you do want to have a prophylactic mastectomy. And so we
I remember our first conversation. Do you remember? We were
It was that number.
We were at the Net Bar.
Yeah.
Cute.
And I always thought that you were, I love that you were so proactive in seeking me out. And I remember you coming up to me just saying, do you think we can have a quick phone call about this? And I remember saying, well, I'd like to meet you in person because I think this quick phone call just won't do it justice. And I loved meeting with you and sitting with you in the nut bar.
Yeah.
And it's funny to think
the nut bar.
at the nut bar, but it's also funny to think so many years later.
Okay, well, Toni, let's get into it because we want to cover a lot, and we really want to use this episode to just help women kind of get the best information about breast cancer detection and treatment and prevention in a really easy, digestible way.
Sure.
I think probably the first question and the biggest one that I have, and I think a lot of my friends have, is what age? And I know, we always ask this, but this is probably the number one question. I know it might vary place to place, but what age is a woman getting a mammogram if she has history, if she doesn't have history? I know there's different recommendations, but what do you say to a woman?
Okay, so you asked such an important question. It's also a very contentious topic, but I'll tell you what the current guidelines are, and then I will tell you what I personally believe and what I counsel patients on. So the current Ontario guidelines, and it's different province by province. So, but in Ontario, if you do not have a BRCA or some sort of a genetic condition, or a strong family history or personal history. So if you're just deemed a normal risk, like you, Lani, normal risk, then you do not qualify for screening until you're 50. Okay. And the other caveat to this is not only do you start at 50, but you end at 75. And currently they're saying that you should be screened every 2 to 3 years. Not even every year, but every 2 to 3 years. And actually the same task force that put forward this recommendation also recommended against women doing self-breast exams. Okay, so we'll just sit with that for 1 second. And I will tell you how I personally feel. And I'm not the only one who shares this view. I think many of us at the cancer hospital that I work at feel that age 50 is totally an arbitrary number. I mean, there's nothing scientific or biologic that states you start developing breast cancer when you're 50. In fact, what we know now is that women are diagnosed earlier and earlier with breast cancer. So unfortunately, that's one statistic. The second statistic is something like a little under 20% of women diagnosed with breast cancer are diagnosed between 40 to 50. So by screening a decade later at 50 rather than 40, 20% of the women they're missing. Yeah. So the reason that early detection or screening is so important is that you have to catch breast cancer early. If you catch it earlier, prognosis, so survival is better. Treatment is much less harmful or damaging. Chances are if you're, caught early, then you don't require things like chemotherapy or you can avoid radiation, which can really impair your quality of life. And the other thing about these screening guidelines is that it's just putting everyone into this generic box, saying that everybody is kind of the same. Your risk doesn't go up until you're 50. It's actually not true in certain racial populations. So we actually know from very good studies that Asians, Black women, and Hispanic women peak in their diagnosis for breast cancer between 40 to 50. So these guidelines are not respecting, the statistics and the fact that there are different racial, propensity for developing breast cancer. So that's why when I see a woman in my office and they ask me this question, my answer is go to your family doctor and say, I think it's important that I get screened starting at 40. Okay. And the other thing about Ontario that's interesting, and it differs again from province to province, is that in Ontario, you cannot self-refer. So someone like Lani, let's say you, I mean, you're in a different category, Lauren, but Lani, you can't just go to an imaging center and say, I, Lani Levy, would like to have a mammogram because I turned 40. Right. They will say, well, you can't self-refer. You need a referral. Note. Yeah, you need a note or a referral from your family doctor. Right. So I would hope that most family doctors will say, Lani, you're 41. I don't see a harm. go for it. I think you're being proactive about your health.
Right.
And I think most people are. However, unfortunately, because I work at a cancer hospital, I sometimes see
And
the
hear
worst
stories,
cases, right? Of women who have been turned away by their family
Right.
doctor. And COVID certainly didn't help the situation
No.
because they're not actually there to examine you in person.
Of course.
So some of the family doctors are like, no, I'm sure it's just
Right.
a benign condition. Just leave it. You're only 40 or you're only 30 something. You can't have breast cancer. It's fine. And then they come 6 months later and it's a mass.
Ugh,
And
yeah.
it's gone into a lymph node. So I'm not, I don't want to, one of the things that I always try to avoid is striking that delicate balance.
Mhm.
I don't want to fear monger. That's not
no.
why
Yeah.
I'm here. I want to give people the
Education.
tools.
Information.
Yeah, the tools to properly take care of their health.
And
So-
just one thing, if someone was just to know the guidelines and see what they were eligible for, then they would be misled in this
Yeah.
situation based on
Absolutely.
these facts. So like, it's
It's
very
to-
important that like
It's
that
misinformation.
and then it makes me think, why are those the guidelines and why is that not being changed? If professionals that are, in this industry, specifically specializing in this, have been to school for 10 plus years, why are we not adapting?
So part of what I do and part of what I use the Belinda Stronach chair
Yeah.
position for are these the extra advocacy work that we do.
Yeah.
And it's not just me, but it's a panel of us. We are from Princess Margaret. There are people from Ottawa, but we volunteer our time and we sit on this task force and we are compiling what I hope to be really compelling data and finding a way to present it to our government because that needs to change.
Wow, good for you.
incredible.
So yeah, at a system level, that for sure will need to change.
Yeah.
But as we know, with any
takes time.
government bureaucracy,
That's amazing.
it
You're
takes
putting
time.
in the work and doing it. Well, your firsthand experience and knowledge, like that's where it should be coming from, right? Like,
And then what do you suggest for women who are 40, who go to their family doctor and they're like, I don't think it's anything, or I don't think you need to get screened.
well,
Like
you know
how,
what, maybe also let's start with even the examination of it, right? Like,
Yes.
how do you even before you get there?
Yeah.
We should get there. What do you even do? Let's say for these women that you mentioned that are at home, it's COVID, they can't see a doctor in person. Or they're just feeling, COVID lasts for 2 years. She's 40, she's 42 without seeing a doctor.
It's an
what are
excellent
we
question,
looking
Lani.
for?
So I think that just as a public policy, starting at 40 is probably a good point.
Okay.
But I think that women as young as in their late 20s or 30s
Okay.
should be doing monthly self breast exams.
Okay.
And again, it's not something that is taught, but I do actually want to change that. In my future project, one of the things that I think is really important is making a high quality video. And that's going to make it readily accessible for people
great.
to
Yeah.
show them how you do a self exam. I mean, I tell my friends this all the time. If I can teach it to a 21-year-old medical student or a 25-year-old medical student, I can teach it to my intelligent friends and other intelligent women how to do it. So it starts with what we call inspection. And back up when you should do it, because I think it's important to do it around the same time of every cycle. So we know your breasts are probably most quiet around day 7 or day 10 after your first day of menstruation. So somewhere around there, it's probably a good idea to set even a monthly reminder in your phone. Just like, you would pay for your bills on the 7th or whatever of your cycle.
Feel up self.
yeah,
So yes,
yeah.
exactly. Do
Get your, get your,
self-breast
par- get
exam.
your
Go to the
partner
bathroom.
involved.
You maybe Lani,
Get
in your
Darren
calendar.
involved.
In your calendar would say, feel yourself up.
Feel.
A little less technical.
Yeah.
But look at yourself in the mirror in a well-lit room.
Mm-hmm.
Look at, the front view, look at the sides and the things that you're looking for. And it's important to do it repetitively because that's how you detect change.
Right.
You only detect change if you know your own norm. So look to see if there's dimpling of skin. That's an important sign. If there's dimpling, that usually means that there's a mass underneath that's retracting the skin.
Oh.
And if you're large breasted, then lift up your arm so that you can examine the
Underneath.
under surface. Don't neglect that. And then see if there's any discharge from the nipples or indrawing of the nipples. Because again, those are important signs
Signs.
of breast cancer.
Good to know.
And then you get in the shower and you do in circular motion with 2 or 3 of your finger pads using light, then moderate, then deep pressure. But I'm telling you guys now where the sort of the boundary of the breast is, starts at the collarbone, goes all the way to the middle of your chest plate and goes to your, like the front of your armpit.
Okay.
So with the circular motion, palpate. So just,
Right.
Do this and do it thoroughly on both sides. And don't forget to check
Armpit.
under your
I
armpit.
know that's what everyone
And
says.
definitely
right? Because
check for lumps or bumps there. And you're checking for lumps and bumps. And it's okay to feel sometimes some irregularity or lumps and bumps. But just know that, if you feel something that's soft, rubbery, that's mobile, movable, that's probably all just benign. But if you start detecting something that's like really hard, and I kind of liken it to like gravel, like a stone, like really hard like that, something that's fixed that you can't like move it around, and
Oh,
that's
that-
really
okay.
irregular, then
that's good because a lot of women have lumpy boobs,
Yeah.
especially their mass. It's all about dense, right? Like
Yeah.
sometimes density can.
and then let's talk breast density after, because that's
okay.
another piece
Okay,
of
yeah.
Well, and I was also going to
depending on
ask
how-
about implants too,
Oh,
right? If
yes.
the
Ding,
breast
ding.
exam
Yeah.
changes,
Yeah.
because I feel very detached from my boobs right now.
because
much as
oh,
they
is
are
this
very
because
much
of her
attached.
implants, like
Because
is
of my
it-
implants,
because you
feel
don't
like
have
I
normal sensation?
Not only do I not know how to dress for these new boobs,
Not only are her areolas
Oh,
out,
that's right, the
her-
areola
yeah.
demonstration.
but I also feel like I don't know, like I have different feelings now. As we know, I can't really feel my nipples, which is interesting. And then along the sides, it's just my body hasn't fully.
But you know what? I tell this to my patients too, who have undergone
Yeah.
various breast
Yeah.
surgeries. The more detached you are from your breasts, the more you need to actually touch your breasts and massage them and feel them. Because no, there's such
Yeah.
a thing as the more you neglect it, the more your brain kind of
Forgets about it almost.
dissociates
Yeah.
yourself
I'm like
from it.
pushing my boobs as
And then
she
the
says
more
that.
foreign it's going to feel.
No,
so
it's
it's
true.
actually better to start massaging and desensitizing. And like, even if it's a little foreign or uncomfortable,
It's,
but
for
start
me,
getting
it's not.
used
I'll
to
do it right
feel.
now. I don't know why I'm not.
Well, I think it's more just for women is getting into the habit.
and I like
know
that.
this happens
Totally.
every year where I feel like because we do actually, this is our 4th or 5th time
because
doing
it's the
this.
time of month.
We usually do an event. This time we're doing it on the podcast.
Thank you. This
But
is the 5th time. I was thinking
It's
that on my
crazy.
way over here.
It's really amazing.
You guys are amazing for giving back to the community too.
Well,
Seriously.
It's a thank you. It's a good platform, and we've got a lot of. I mean, our
we want to learn, so we assume everyone wants to learn. Like it's like such a benefit having.
But I
you
think
as a
you guys
friend and a tool
inspire
and a
you
resource.
inspire other people to want to learn too. And I think it should not be
well, I
something
think you've
that we
got
ignore.
to
It should
take
be
your health.
taboo.
Listen, I think especially as moms, your health
Mhm.
becomes secondary. It's like the minute you have kids, I'm like, oh, this feels funny. Well, I'll push it off. Or I've got to, talk to this hormone specialist. Well, I'll do it like next week. Meanwhile, for my kids, I'm like, get them in here, talk to this expert, do this.
Totally.
So I think as moms, it's kind of like reframing it and thinking, okay, my health should be the priority. I am like the person in this home who's running everything. If I'm not
Yeah.
good, no one else is good. And just starting to put your health just as important as your family, if not more important, right?
Totally. And I
So-
think it's an important lesson to teach your kids too, that you look after yourselves.
Yeah.
And it doesn't take long.
Yeah.
Like it sounds like it's onerous,
Yeah.
but once you get into a routine
it's
of
the
it,
habit,
it-
of
it's
getting into
the
it.
habit of
Yeah.
getting into, you commit 5 minutes every month to doing it.
Can you teach your partner how to do it?
You can, you know what? Sometimes I do have women who come.
Sounds like
and
Gary-
it's,
Gary would
it's
love
their
that.
partner that have detected
funny
it.
about that. Mark is very like I actually just trust Mark
So
more
that's
than
actually
myself.
a really,
he's
like,
really
smart
thorough,
thing.
and he's like very like I feel like he's just like I don't know.
He knows your
He
boobs.
knows my
All
body
roads
once.
lead
Well,
back to Mark
He knows your
Gary.
nipples
No,
very
but I
well.
just feel like I would like a second opinion. Like, was this your last month? Like, I'm like that girl is the iron unplugged. Like, I just
Totally
want
use
that
them as,
confirmation as like it's whatever. I do have lumpy boobs, and we'll get to the dense thing.
Yeah.
So sometimes I'm like, was that bump there before? I don't remember. And especially if you're supposed to check, as you say, when you're menstruating.
After like 7 days.
So
Yeah,
like basically the end.
basically the
Okay,
end or
because I
like
was
a
gonna
few
say,
days
mine
after.
Are actually quite sensitive when I used to menstruate. Now I have an IUD.
I think we're sensitive premenstrual and maybe during, but at 7 days
the end?
after, like
Okay, so
it's
then
it's
it's
quieter.
normalized.
Yeah.
Okay.
Right.
But that's really good.
No,
to
I
know.
think that's actually smart. You do it yourself, rely on yourself, but always have somebody else check
Double
it and
check.
just say like, do you think that this was there?
Yeah.
And then it helps like to have a partner doing this with you.
Yeah.
For sure.
And so if you do have more dense
Dense,
breasts
yeah.
or implant, like what is the protocol?
So I actually posted about this on my Instagram because I think density.
Oh, I saw that. Yeah.
Yeah, I think density is something that women talk about. They're, they say, I've been told I have dense breasts, but the actual definition for density, I don't think is well explained. So density really refers to how much fatty tissue your breast has versus breast tissue. So on a mammogram, there are 4 categories from the least dense to the most dense. So the least dense, let's say category A, is when your breast is mostly made out of fatty tissue.
Okay.
And it can be in anyone, but mostly that is in postmenopausal older women. Okay. So density. And then it goes, the middle 2 categories is, when you have a little bit of density, then category 3 is when it's called heterogeneously dense. So about 75% of your breast is made out of breast tissue and only 25% is fat. And then the last category, category D, is extremely dense. So more than 75% of your breast is made out of breast tissue. Generally speaking, younger women tends to have dense breasts. But just because you feel lumpy and bumpy doesn't actually mean that you have dense.
Right.
Like this is really a diagnosis that's made when you look at the mammogram. But if you're in the 4th category of having extremely dense breasts, this is important information to know because we now know that people that are in the highest extreme density category, they are at higher risk for developing breast cancer, just as high. And some people think even higher than family history.
Wow.
And secondly, dense breast also masks breast cancer. So a breast cancer that happens in dense breast, sometimes you can't see it.
You can't detect
because
it
everything
it's
sort
so-
of lights up, right? So I think this is like such important information for women to know. And unfortunately, most women, I say like 95% of women, unless you have personally dealt with breast cancer, do not know where you stand on this spectrum of density. But I think it's important information, and I think it takes 3 minutes, but it's important for whoever's reading this for you, like your family doctor, to just sit down and say, Lani, you have category C or D. And because you have category D, your mammogram may not be enough to really examine your breast carefully, that make sure we're not missing anything. You probably could use an ultrasound.
Right.
And from now on, in addition to a mammogram, you should probably annually get an ultrasound and mammogram.
Love that.
That's so interesting. So you can get from your family doctor, you can say, can you test the density of my breast?
Oh, so it's reported. It is always reported in your mammogram, but it's not always.
It's like when they physically do their examination, they can do it. It's not a tool. It's just from their touch.
It's just from
they know.
Just from them reading.
It's from the mammogram.
Yeah, it's
So you'd have to get
interpretation of the mammogram.
But I haven't had a mammogram.
So that is when I think, Lani, how are you even 40? You're not even 40.
No.
So Lani, my advice for you.
32. No, I'm 30.
My advice for you is in your 30s, and my advice to you and all of our listeners, in your 30s, really learn to understand your breasts and know what they feel like. Do your monthly self-examination. If you feel like something is persistent for, let's say, 3 or 4 weeks, that just feels not right, please call your GP
Speak up.
and say, I feel something, and I don't think this was there. I've routinely done self-exams. Can you please either feel this yourself? And then in addition, please send me for some more imaging.
Yeah.
I think that is important lesson to our listeners. And then I think at 40, everyone should be getting screening mammograms. And then on your screening mammogram, please look for that density. And if you belong in category D for sure, or even if you belong in category C, and that composes of 40-something% of women belong to category C or D.
So then you might be getting mammograms instead of every 2-3 years, maybe every year.
I think everybody should get mammograms every year.
Okay, and I hit 40.
once you hit 40.
Yeah.
I think that should be the screening guideline.
But you have right now. That's not in Canada. That's not the
Right
guideline.
now
so you
in
have to
Ontario,
ask,
every 2-3 years.
Okay.
Yeah, right now in Ontario, that is not the guideline. Now, I do think that in some other provinces, I think the Atlantic provinces and BC, and actually I think Yukon Territory, they start screening at 40. So there are some provinces that are more progressive than us. So I think we are headed that way. It's just, if we can make that happen tomorrow, it's probably
those
a
are
day
really
late.
good takeaways.
They're incredible
that are
takeaways.
easy to do.
Yeah.
When you're in a position, then when we can, you can ask for that. You can get those. Just
Well,
having
even
that little bit
the dense breast thing, I had absolutely no idea. I did have one question about the self exams because we have a lot of followers who are young moms or maybe expecting. When you're pregnant, obviously your breasts really change throughout your pregnancy. So how does that self-exam change when you're pregnant? Because I mean, during my pregnancies, and because I was BRCA positive, so I was followed by women's college, but I remember my doctor there was just like, oh, you're pregnant again. She's like, we got to get a screening in there because just like, she's like, it changes so much and the texture and everything changes. So what is your suggestion for a woman who's expecting, who, is in her 30s or 40s, regardless of history? How is their journey different with their self-exams?
So for sure, I think that a self-exam becomes much harder to interpret because like you said, the hormones are all fluctuating and you probably do feel more sensitive. So I would say during that time, obviously still do a self-examination, and if you have if you're very concerned, do approach your doctor. But chances are they might just say, okay, we'll follow you along. Let's just make sure you're not lost to follow up. But let's follow you along and keep doing your self-exam. And if you start, if this becomes larger or really firm, or you feel like or see the signs that I was talking about earlier, then we should not neglect it. Even if you're pregnant, we need to do maybe not a mammogram, but let's do an ultrasound. Let's do an MRI. Yeah, there are other imaging that's compatible with pregnancy and follow it up. But knowing that during pregnancy, it is a time of a lot of hormonal fluctuation.
Well, also the hopes that before pregnancy, even though things are changing, you're starting to know your body better, right? If you're doing these examinations, so I remember in pregnancies, there's ebbs and flows too. At the beginning, they get. Anyway, so it's just the more you know about your body, even when there are changes going on, it will still, what you're saying is use your intuition. If you feel something that's different, no matter what stage, you should just say something.
Just say something.
Say something and
exactly.
advocate for yourself.
Yeah, don't deprioritize it and really get to know your breasts. And there's no reason why, somebody in their late 20s shouldn't be doing it. If you are concerned about it or if it's on your mind, then just incorporate it into your routine.
I think a lot of people are also just like, it's not top of mind because they don't think that they're not
that
the relevant age.
Yeah, so
and then I feel like the stories that we are often hearing or the referrals that you're
it does seem like younger and younger. And I don't know if there is a correlation between, now there's so much around fertility treatments and hormones, like if that is the rise, or we're just in an age where we're hearing more of it. But it feels like so many people we know or friends of friends, like this is happening.
Totally. So I don't know that any of us can pinpoint to the cause, but definitely women are being diagnosed earlier, not just with breast cancer, but colorectal cancer is another one. And so we don't know if it's even just hormone that we're exposed to in the environment. I mean, there have been a lot of studies and they have generated really mixed findings as to if women that are on oral contraceptives, are they at higher risk? But really, it's mixed, and there's no compelling evidence that if you've been on birth control for many, many years, that you're a higher risk. So it's hard to pinpoint, but for sure, it's getting younger, and I think we need to not just think that we're immune to it because we're not 50. And the other, I think, big myth that I want to debunk right now that I want to share with our listeners is that the vast majority of women that are diagnosed with breast cancer actually do not have the gene or do not have family history. Wow. So 70% of people diagnosed with breast cancer, we call it just sporadically develop
70.
70.
That is
so half sporadic. That's a very high percentage for it to be.
Yes. So therefore, don't just be comfortable in the fact that, your mom or your aunt has never had it, so that, it's not going to happen to me.
Yeah, you're not a probability.
Right.
Even.
Well, maybe you're
Like,
also
you might
less,
be, but
maybe
it's like,
you're also, it is less top of mind. You're maybe not checking your breast as much. You're not pushing for the
what I
mammogram.
mean. Like, I would have
You're-
never.
yeah.
I don't have
Yeah.
family history, so I would never have thought, even at this age, that I have to even
that
be
you're a
like,
bit- you're more
I would be like,
invincible.
I probably could wait to 50 because I don't have family history. Like,
Exactly.
if that's 70%, then I'm
It's
at a
70%.
higher risk than people with. So it's great. It's
Well, so it just means that none of us are really immune to
Right.
this,
It's-
and that we all need to be proactive and take these, like, learn what we can do to help ourselves.
And I think the thing that I know keeps on coming up, because I feel, unfortunately, to your point, there's been a lot of stories that we've heard that you've sent to Toni just through the past few years. And what seems to be, like, to your point, is the earlier people can detect that something's wrong and they're in,
Yeah.
it seems like the whole life cycle can be drastically shorter, right?
Absolutely.
And every
Absolutely.
situation is obviously different and particular
Right.
to their own situation.
sure.
But, like, we met with someone in her situation. We met with her a year and a half ago, and where she was today versus
Well,
it-
that story was pretty crazy.
it was insane.
Yeah.
She had been diagnosed.
She had not been diagnosed.
Well, no,
she had
sorry, when she
found
died, you're
she
right.
had found a lump, and I feel like this story is something that comes up a lot, where she
Right.
found something.
Misdiagnosed.
She was misdiagnosed by a radiologist, by
First her family doctor,
first her family
then
doctor,
her
then the
radiologist,
radiologist, then a very reputable healthcare provider. And then she called me because she just knew I had shared my story, and she didn't know who else to call. And she's like, I feel this, something feels weird. And I'm like, it's so funny you're calling me. We're hosting this breast cancer event
That's right.
tomorrow
That
with
was
Dr.
last-
Zong and
last
Dr.
year.
Sill.
Was it last year? It was.
It was
It
this
last
time
year,
last
a
year.
event. Yes.
She came to the event.
Yes.
I introduced her to you. I know she'd already been in
had
touch.
a biopsy.
She just
No,
had a
so we just
she just had a biopsy
she had been
that
in
week
touch
because of you
with
guys.
someone at Princess Margaret.
Yes.
They basically got her and
A
they looked
patient advocate.
at
Again,
it
yeah.
right away. Your patient advocate there,
Yeah.
who is another angel, another angel.
Amazing. She was like, do not let these.
Adina,
She-
Adina,
Adina,
who
what?
is-
I was like, I don't know if I've ever met an angel.
I think we could talk about Adina, because Adina is
Adina
like outside of my
is-
circle. Adina is a force of nature. So you know what's so funny?
Yeah.
Is she's it's not funny. It's actually just amazing.
Yeah.
Is that she volunteers at my breast cancer
Yeah.
reconstruction clinic. She volunteers across the hall at our medical oncologist and at the breast surgeon's clinic. But she is such a force to contend with. She's like, I know you have a full list, but I have this patient. She needs to be seen. She is a single mom, blah, blah, blah. You need to see her. You cannot ignore her. I'm not letting you turn her away. And so then all of us are like, of course, like, bring her in. And then to the point where our medical oncologist once said, Adina, the only reason that you cannot be fired is because nobody pays you. Like, we can't actually get rid of you because you volunteer. But if you're an employee, we would, like, somebody would escort you out. So she brought this, like, you guys brought her to the event. And then Adina brought her
wing.
that night.
Yeah.
Yeah.
And she said right away, this person we just met with her, and she said, Princess Margaret looked at it and was like, yep, this is cancer. It's aggressive. It's a triple negative cancer. It's not hormone related, no genetic history. She's young, beautiful. Like, she is literally the last.
She's in her, like, early 30s.
Young
Very
baby.
young, very young.
And she has like a 3-year-old daughter.
She's a young mom. And
Oh,
it was
she's a
the
young
kind
mom.
of thing that if she
No
said to us
family
now, if she
history, yeah.
had not caught it and been proactive and advocated herself, she would be dead.
Yeah.
Like, she literally, they were like, chemo is the only thing that can basically cure
Yeah.
this. If chemo doesn't get it, this is it. She didn't know that, she read
Oh,
about that
yeah.
or found out about that afterwards. But I just want to say she is cancer free. She is good because she was like, I'm not taking no for an answer. She was like, I went away and she was like, something in my head. And this was the same story
Sorry,
as
our
other
other
people on the panel where it
Yes,
was like,
our other
you know
patients.
what?
It's
Something
common. It's sad.
I'm not taking this diagnosis as a no. So why don't maybe you can share a bit for our listeners? Okay, so they're doing their breast exam. They feel something. It's
Yes.
the little pebble. It's not moving. It's been there for 3 weeks. They see their family doctor. Their family doctor is like, I don't think it's anything.
No, I think you don't walk out the door. I don't think if you legitimately feel that you know your breast, this was not there. This is firm. This is irregular. This feels to you like a danger sign. You don't leave until you say, and you ask why you ask your GP, why do you think I don't qualify? And if you say, well, because you're not 50. And chances you don't have a family history. And then you say, and then you say, well, did you know that 70% of women that are diagnosed do not have breast cancer? And do you know that 17% of women with all breast cancers are diagnosed between 40 and 50? Therefore, I am not going to leave until I get a requisition from you.
Why are they so stingy?
Toni, I feel like you should be a lawyer. I feel like I need you just in different parts of my life fighting for me for things.
Maybe I'll be on a debating team.
Keep her close.
Yeah.
But also, why are they so stingy? Why is this this is so weird.
It's an excellent use of word,
honestly,
stingy.
I'm dying. I think I have cancer. And they're yeah, no, we're good. We're going to not give you. I don't actually even get it.
Because sometimes I
know
think
it's money and I know it's a procedure and I know people can then.
But it's a non-invasive diagnostic.
Do they think people will abuse the mammogram?
No, I actually don't really know. I really don't know. I think if you go in and say, I have done self-exams, I take this very seriously. I am not just coming in with some flight of ideas. I know my body. And I think that this needs to be further investigated. I find it hard to believe that they would just say, no.
I guess that's just really hard to do.
Yeah,
what you just said, that's really hard to do.
Maybe.
For example,
I've never thought of that, but maybe.
The girl that we're talking about, but she didn't know. She wasn't sure she had cancer, right?
I know.
She thought she felt something. It was most people in that situation. And it's you're thinking of it, and I'm just being real from such a scientific, that's a pebble that's a millimeter, blah, blah, blah. I'm oh my, okay. Yeah, it feels about the same. So my kid yells or whatever. You're, as much as we need to take time to do it, it's not coming at it from the same perspective though. So maybe it's just one of those things where.
Maybe we need to develop a script, an actual, a verbal script for when they go in there and say this.
I think your video with your facts
I have
could
some
be amazing.
ideas how to make it go viral too.
Whoa.
Thinking of
Lani's going to create a TikTok of her areolas.
No, I'm just
I am
thinking
sure you guys
we could
do.
also, I think what the most important thing is the takeaway here is that people, as soon as they start to have breasts, should be comfortable with them. So I think this could be something that goes into just training young women. I don't know where, you don't do that at a university level. The minute different than sex ed. Professor gets
which they do teach at a young age.
They do. But you're right. I never really thought of that.
And where are all these eyes? All these eyes are on, I don't know, TikTok, all these platforms. If you did something engaging and cool, I feel
educational and really, really useful.
But
right?
I think even just those things that you said, that is so impactful that most women do not know about the percentage of risk if you have
do not have
history,
family
about the age, even about the racial propensity, about the density to ask for. There are so many nuggets of information that you've just shared that as someone who is even kind of from this world as well, I'm just I had no idea.
Right.
I have 3 girls. That is very interesting information.
And you know what? I've also learned from you guys because it never really occurred to me, but you're right. Using our previous patient that we were discussing anonymously as an example, but I never really appreciated how shy or intimidated they must feel in their probably older GP's office saying, well, I don't want to take no as an answer. You know what? Especially when it's people, I really find people that have come from another country, like my parents. My parents, if they go to their family doctor and they say, you don't need that. They would never say,
they would never question it.
They would never question it or try to advocate for themselves. They would just say that, I think they know best.
You trust the
and
opinion.
then walk out the
It's
door.
not even, there's a reason you're a doctor and you get paid what you paid and you work where you work because you worked your ass off to get there and you're qualified. When I go to doctor's office, I'm I am not a doctor. I am now leaning on you. This is your role. Not that I want to be an idiot, not advocate for myself, but you do yes, get second opinions, of course, but there is something in that. In our healthcare system, we pay a lot that goes into that. I hope that my GP or wherever I'm going to is telling me accurately. I feel like it's shitty that we have to really fight for ourselves sometimes in these situations. But
I think it's rare, but when we do hear these stories, they really are a reminder to ourselves that ultimately we are most accountable for our own health.
Yeah.
And if you really have that intuition that we talked about, don't ignore it. And don't let people second guess that.
Don't be intimidated by the guidelines or the medical system to shy you away, right?
I think it's also feeling not a burden, but you don't want to be one of those people that's like, oh, I don't want to feel like I'm making a big deal of something.
Yes.
Well, and you really don't know. Like that's the other thing. That's really the thing. I think it's so hard to be so certain or so when you know, it's really easy to advocate for yourself when you know your points and you know very, you know, like you've got.
But to your point, most people don't know, trust their GP's opinion. And
they really have to feel either physically unwell, see a sign, or no. I mean, thank God women and intuition, right?
Yes.
Like,
or find
as a mother, like it just is, that is our sense, you know, just feeling that something is off, and whether it's something as detecting breast cancer or just what we've dealt with in life as a mom, you know, or a woman, just knowing like, this doesn't feel right. I'm going to just.
Yeah. And you know what? And that is, it goes also back to, this is why we're in a community. We're in a community where we can talk and we can share and we can help each other.
Right.
Yeah.
And that's what your event last year did. It brought that poor girl. I saw her at that
It
event.
saved her life.
It saved her life.
Saved her life.
It saved her life. She came in, you know, that night.
A random DM from like, it's crazy.
Random DM, and you invited her, and you said, we have some oncologists, like a surgical oncologist and a breast reconstruction surgeon. Maybe you can talk to them. She had the biopsy done the week before. She didn't even have a result that night.
But she knew.
But she said, she was like, I think it's not going to be good. And I said, well, don't feel that way. Like, because I'm really very positive.
In your position too, because you want to be supportive and you want you know,
totally. I was supportive, but I was like, don't, you know,
don't
until you see the biopsy results, like don't think that you have breast cancer. And until I see it, you know, then we'll deal with it.
Yeah.
But don't
assume and think the worst
and start, you know, kind of planning your chemo and all this stuff. Like, please don't. And then she showed up in my clinic like 2 weeks later, and I thought, oh my gosh,
I can't.
Thank goodness she found Adina. She did not ignore her intuition. She came to your event and she took this really seriously.
Yeah. But that's why, because she's going to be sharing her story, and she's like, she actually hasn't told many people. And I'm like, listen, it's obviously your choice and you have to be comfortable with it. But know that in sharing your story, somebody is going to DM you and you're going to be that person to somebody else. And you're going to take them under your wing and give them your information and share your story. And I'm like, all it takes is one person.
Absolutely.
So I think that is the biggest thing. The more we share stories and the more we talk about it and the more we pay it forward and share the information, the more knowledge women will have. And hopefully, you know,
with this specific type of cancer, right? The biggest thing is when detected early.
It's the most Is it the most preventable?
What is a stat there? Just because I feel like a lot, that really goes to show why self-care and exams are important.
Exactly. So if you can catch it early.
Yeah.
So breast cancer, I mean, there are different subtypes, but most breast cancers they grow relatively slowly, and it takes time before the breast cancer cells can escape and go to your lymph nodes. The first place that it goes to are your lymph nodes, usually under your armpits, but sometimes in your chest. And then it goes to the rest of the body. So when it goes to the rest of the body, that becomes stage 4, metastatic. And that is where prognosis is worse. So if you can catch it early before it gets to the lymph nodes, or even if it's just microscopic cells in the lymph nodes, then we have ways of treating it with chemo, with radiation, with surgery.
When it's isolated.
That will give you, you know, the cure rate is excellent. And I do want to leave this conversation with some positive statistics or positive data. Like, I think after all, we're doing this because it's October, breast cancer awareness. And I think we need to, there are things that we can celebrate about how far we've come in this. I think one of the biggest things that we can celebrate is breast cancer death has been halved in the last few decades because of treatment and because of early detection. Wow. And that is amazing.
That is incredible.
Yeah.
And it's because of early detection, because of all of our great treatments that we have. And then I think that's probably the number one thing that we can celebrate. That even though it is so common, women that are unfortunately dying from it is half.
Right.
So that's important. And I think the second thing that we can take away that I think we can celebrate is we're coming out with better, more personalized, like really cutting edge therapy that's tailored to your own genetic makeup. And that is incredible. So how we treat breast cancer in one person may be different because depending on your response and depending on your own genetic makeup. And all of this, keeping in mind that we really want to decrease impairment from, these treatments. And so I think we've also come a really, really long way in that. And I guess lastly, because I'm a plastic surgeon, I do reconstruction all the time. I think that the ability that we have and the surgical tools that we have in reconstruction has come such a long way that it makes people like Lauren, like young, beautiful women who unfortunately have to remove their breasts for prevention of cancer, so much more tolerable because you know that you have a plastic surgeon who has your back, who understands your goal, and who wants to make you look and feel good. And I think that's, it's just amazing support that we never had before.
Yeah, that's incredible. I mean, I think like for me as a woman, it's like the scariest thing, and you don't want to sound vain, but it is, how am I going to look
Totally.
post-treatment
And feel about yourself.
You want to still feel like, you don't want to look sick. You don't want to look different. You want to feel the same. And I mean, not to keep referencing this person who we're talking about,
her wigs,
but with not just her wigs, but her biggest concern. She's like, take my breast, but she had to get chemo treatments. She's like, I'm so, my hair, my eye, just everything. And I know I'm sure you see it as a concern with so many women. And what she said, she had this wig on. I could not believe it. It looked incredible. And she was like, it's not about being vain, but it's like, I didn't want to look sick.
Like yourself.
I didn't want people to think that I was like, there's that sick mom with breast cancer. She's like, I literally wanted to just look and feel like myself. And because of these advancements that you're talking about with her breast reconstruction, with the wigs, with everything, she's like, I do feel like myself. She's like, it's honestly been so fast that she's like, I can't even believe this happened to me
within a year.
Because she also looks in the mirror. She does look like the same person. So
she has her expanders, and now it's just she's got long waved hair. She was wearing her outfit.
She looks amazing.
She looks amazing.
And that was
so
the point,
happy. She's so amazing.
But that is a testament.
Her life could have been, who knows,
very different
now, and that because of the networking, and that is like, it's the beauty of community and like sharing the knowledge, and like full circle to what we were talking about before. Like, we're like, what is the point of this podcast? Like, we're here to have a good time and talk, but for us, it's like anything that we find that we think is a amazing resource or a tool or educational that we would be benefiting from, we want other people to benefit from, because what is better than that?
Well, like I said, when I first arrived here, you guys are really the most generous people I know. Like, you really are.
Lauren,
you're about to share your producer Ryan. You're about to share all your content. You don't even
really
think twice
for
about
Toni to have her own podcast.
Yeah, I'd listen. I'd listen.
I think we would all listen. Honestly, you have a big fan base.
Well,
you do.
Thank you so much, and I'm so happy to be on your podcast. But as a guest.
Yeah.
As a guest.
Whatever. This is baby steps. Baby steps.
We're gonna get
But you
there.
guys are amazing. Like, you are excellent.
Lauren
moderating.
You are moderating to be.
You are like
she
the
should
Barbara
have a TV.
Walters.
I'm telling you, I call her Barbara.
Do you call her Barbara?
Yeah. I was like,
maybe Barbie.
I don't know what we're really getting into here. Like,
but
the
it's
first
just Barbara. Who are you, Lani?
I don't know. I'm like a guest always on the show. I'm literally here.
Like a chronic here.
I'm just a chronic guest.
Lani asked me one question on the previous episode,
and like, you made me ask you the question. You're like, so ask me the question. I did.
What was the question?
Well, you'll listen to the next podcast, and you'll hear it. Anyways, we're honestly so grateful.
I always
to have you on
being here with you guys.
You're an incredible doctor friend. Like, you really have touched so many people in such a positive way. You're a light. Like, you.
Yeah,
I'm gonna get emotional.
Oh, Lan.
Lauren.
Wait, Ren. I looked at Lani and I said Ren.
She doesn't even know my name, but it's okay.
Ren. No, of course I know Ren.
Oh, Ren.
I know my Ren.
It's true. Honestly, you are one of a kind, and we're very lucky to have you in our lives and part of our community here in Toronto to help.
Nothing like the dog to
the dog is announcing someone.
Anyways, we love you, as you know.
I love both of you guys. Thank you for having me. You guys are incredible people and wonderful friends.